So quickly looking at the next classification of what adrenergic drugs, we are looking at what is known as alpha 1 and alpha 2 selective. Alright, so that means these types of what adrenergic drugs, they will act on the alpha receptors. Alright, so acting on the alpha receptors, they act on all the types of alpha receptors, both the alpha 1 and the alpha 2. So for what we got, we said that they are a fascinating class of medication. So they target what? They target alpha adrenergic receptors. So they play a key. The alpha adrenergic receptors, they play key roles in regulating your blood vessel tone and how your smooth muscles can contract. So we'll look at the examples of drugs that can act on alpha 1 and the ones that could be able to act on alpha 2. So later on, we'll still break down, and talk about their individual pharmacologies, right? So these drugs specifically, they block alpha 1 receptors, which are found in blood vessels, the prostate, and the bladder neck. So blocking them causes what? Those areas to be able to relax, dilate. All right, so makes them, they can be able to treat what? Hypertension, where blood vessels are constricting, so they make blood vessels to relax. Benign prostatic hyperplasia, where your prostate in the men is actually getting large, so this will make the muscles to relax, the smooth muscles there to relax. So examples of these drugs include things like what? Prazosin, Terazosin, Doxazosin, Tamsulosin, Alfuzosin, Silodosin. All right, so alpha 2 selective blockers now. So these ones, they will basically act on the what? Alpha 2 receptors. All right, so these ones, they are mainly located in the central nervous system, that's the receptors, and the presynaptic nerve terminals. So once you block the alpha 2 receptors, it will now increase the way norepinephrine is being released. So this can actually what? Which can raise blood pressure and heart rate. Do you understand? So examples is Yohimbine, historically used for erectile dysfunction, orthostatic hypotension. These ones are basically done to actually raise things up. All right, so for the non-selective ones, they can act on both the alpha 1 and alpha 2. So drugs like what? Phentolamine, then Phenoxybenzamine. All right, so clinical uses in general, they are used to treat high blood pressure issues. All right, relieve all those smooth muscle constricting issues like benign prostatic hyperplasia, Pheochromocytoma, Raynaud's disease, and post-trauma syndrome. All right, so that's it for this. We'll still come back and look at their individual pharmacologies.